No, but what happened was would you say immediately after, or that evening after you were dancing?
Yeah, it was during class.
During class. You were hobbling coming in here. Afterwards, did it feel painful for about 2 hours, 3 hours?
And then the day after as well.
And then
I started dancing. It was fine, like it was normal or something. And then just straight after.
Today, is it better than 50%? Or is it 50%?
I'd say it's about 40%.
45. So she has a longitudinal tear of the gastrocnemius muscle. So you usually have a transverse tear. You can feel it. The channel affected is the bladder channel, treated using the long channel. I treated Lou's using anatomical similarity. So I picked an area where the muscle joins the tendon. It's an acute injury, so with acute injuries treat small, half-hour treatments, but more often, every couple of days. It's taken till today for it to feel a little bit more settled, and actually movement has probably kept it warm. It's like somebody's been picking you up by your legs. These CrossFit people, I'm not looking at anyone in particular.
I don't do CrossFit. Similar movements, but
Pretending. I don't subscribe to that. I do my own thing.
I've looked into a few places and I've always wanted to do it.
Yeah, like I just joined like the normal like classes that they had, and then they asked me to join the strength and conditioning.
Would your legs be more the weakest part of you compared to, say, your upper body? Or?
No, I'd say my upper body is the weakest. Like today, I could do stuff like because it's like a clean and a jerk, and I could clean it, but I couldn't get it over my head.
When the Achilles heel is compromised or the tendon is compromised, you'll get the tissue will go into the stressor. Actually, your foot will become stiffer and less mobile. And so you find, like in the beginning, I was just trying to strip out any dead blood, and she wasn't getting immediate pain relief. But I know within 2-3 treatments, it's like you'll recover a lot faster. Whereas in the West, we take a conventional route, which is rest, ice, compression, anti-inflammatory steroids, don't move, don't stretch, don't do anything. Whereas we're like, there's a bit of pain needed for you to recover. Do you know what I'm trying to say? Also, I can use the inside of Jessica's foot to gauge how the spine and the pelvis is, because originally she came to me with pelvic issues in here. Okay, so we get some needles. Breathe in, Jessica. So it's more of a direct technique. Myofascial is because she's got a longitudinal tear, not a transverse tear. She has some function, but I'm concerned that it might be more leaning towards the fascia rather than the muscle that's torn. So I want to. What it does when you needle this way, it creates mini stretches, myofascial stretches, the same way as you would do with your clients in the clinic, but underneath the skin. You see the bruises lifting now. All our body's supported in a truss fashion, through the triangular fashion. So body, mind, spirit, mental, emotional, spiritual, structural.